Let's continue our discussion on the invasion of exogenous wind as part of our topic diagnosis according to pathogenic chi. The symptoms and signs of specific endogenous wind pattern are the following. In wind cold, there is aversion to cold and wind, chills, headache, stiffness in the shoulder and neck, lack of sweating, coughing, sneezing, clear secretions from the nose, slight or no fever, itchy throat, no thirst, superficial, tight, and slow pulse. In wind heat, there is less aversion to cold than when there is wind cold. There will be chills, mild or high fever, thirst, red eyes, red and sore throat, yellowish secretions from the nose, cough, possibly with yellowish sputum, superficial and rapid pulse. The tongue may have a red tip or a yellowish coating. In wind damp, there is itchy skin disorders, skin diseases where there is swelling and aversion to wind and cold, heaviness in the arms and legs, heavy and painful muscles and joints, slight or no fever, superficial and slippery pulse in a wet tongue. In wind water, there is acute edema, especially in the face and around the eyes. Cough with various watery sputum, wheezing, no thirst, superficial and slippery pulse, and a wet tongue. In wind dryness, there is dry throat, dry lips, dry mouth, dry eyes, dry skin, dry mucous membranes, dry tongue, and a superficial pulse. In wind B, this is a B syndrome where wind, dampness, and cold have invaded the channel or the joint. Wind is the predominant of the three pathogenic chi. There will be painful joints. The pain will be provoked by the wind or by drafts. The pain can migrate from joint to joint, be erratic, and change character. Sometimes sharp, sometimes throbbing, sometimes numb, sometimes heavy, and so on. The pain can come and go very suddenly and will mainly affect the upper part of the body. There will often be aversion to wind, cold, and drafts. There may be a slight fever and sweating. The pulse will be superficial. In invasion of wind cold in the face, wind cold can invade the channels in the face. It will often be the Yangming channel that are affected. The invasion of wind cold in the face will result in pain and especially paralysis of the facial muscles. The pulse will be superficial and tight. For the treatment principle, we expel wind. In our acupuncture treatment, we can choose from the points UB10, UB12, LI4, lung 7, DO14, DO16, Sanjiao 5, and GB20. If there is wind cold, we can add SI3 and UB62. If there is wind heat, add LI11. If there is wind dampness, add spleen 6 and spleen 9. If there is wind water, add spleen 9 and ren 7. If there is wind dryness, add kidney 6 and spleen 6. If there is wind B, add local and distal points on the relevant channels. If the invasion of wind is in the face, add local and distal points along the channels. With needle with draining technique, moxa and caps are recommended. So for further explanation, UB10, UB12, LI4, lung 7, DO14, DO16, Sanjiao 5, GB20, activate Wei Qi and expel wind. UB62 and SI3, expel pathogenic Qi from the Tai-Yang aspect. LI11 expels wind heat. Spleen 6 transforms dampness, drains water, and can nourish Jin and Yin. Spleen 9 transforms and drains dampness and water. Kidney 6 nourishes Yin and Jin. Invasion of wind can be caused by Wei Qi deficiency and its resulting pattern will depend on the individual pattern. Thank you for your attention. When there is an acute invasion of exogenous pathogenic qi in the exterior, it is advisable to consume drinks that are spicy and diaphoretic to open the exterior and expel pathogenic qi. This could be ginger, garlic, whiskey, brandy, and chili if there is an invasion of exogenous wind, or mint, chamomile, elderflower if there is an invasion of exogenous wind heat. It is also advised to abstain from eating or to only eat soups, for example, such as onion soup. There are two reasons for this. First, when temporarily fasting, qi will not be used to transform food and therefore can be used to combat the invading pathogenic qi. Second, some sources say that the downward movement of food and qi in the stomach can draw the exogenous pathogenic qi inwards from the surface. Similarly, the sour flavor should be avoided due to its astringent or centripetal dynamic. Vitamin C, lemon, and other things that are very sour should not be consumed during an invasion of exogenous pathogenic cold, as they will draw pathogenic cold inwards while closing the pores in the skin and thereby preventing the cold from being expelled again. This also means that antibiotics are not recommended at this stage as they are cold and drain downwards. It is important that the person protects themselves from drafts and exposure to the elements. Invasion of wind can be caused by Wei-Qi deficiency, and its resulting pattern will depend on the individual pattern. Thank you for your attention.